ADHD has a very negative connotation in the world. Today, I want us actually to have a really nice conversation about it and actually a relationship with it because we have a lot of people that are undiagnosed or probably are diagnosed, but they have no idea what they are struggling with. So are the children, even adults. This condition does affect adults. Dr. Unati here. Today, we're going to talk about who is at risk and what are the causes of ADHD and the symptoms, of course, and how to manage it. So, ADHD is a well researched topic. As much as there's so many theories around it, no one really knows the cause, but I'll just go through the risk factors of it and, of course, the age group. Usually, it affects you start diagnosing children with it between 6 to 12. They start showing the symptoms, or sometimes they show these symptoms earlier, but parents aren't aware, or probably they think, no, it's just a child. Basically, the symptoms that are more evident is hyperactivity and inattentiveness. So basically, your child presents with being impulsive, or they probably notice that they don't wait for their turn. Um, they speak endlessly. There's just difficult to contain them, and their emotional regulation is a little bit distorted compared to the age of another child of the same age group. They kind of have that inattentive, or probably their concentration span. They do not finish their tasks at school. The teachers are getting concerned, and of course, their sleep is disrupted. They're a little bit excitable compared to their age mates. And of course, sometimes it affects relationships. Like I said, it could affect adults too. You find yourself that you move from one job to the other, or you are struggling with finishing tasks. It happens also to children. And sometimes children with ADHD, they will struggle with low self-esteem because sometimes with their age mates, they have no patience for these children because, like I said, they tend to have that impulsive, uncontrollable. They are unable to regulate their emotions, and sometimes it could actually coexist with other conditions like depression or anxiety, or maybe oppositional defiant disorders, conduct disorder, autism spectrum disorder. There's other mental health disorders that could coexist with ADHD, not necessarily caused by ADHD, but children with ADHD, they tend to have that risk to have these coexisting conditions. So who's at risk really? Honestly, when you are pregnant, maybe you were exposed to some toxins, or maybe alcohol, or maybe you were smoking cigarette, nicotine exposure, or maybe prematurity. These children, they tend to have that risk because the brain is not yet developed, right? And there's also genetic component. If there's a family history, they tend to children with ADHD have that strong family history disposition. And of course, we don't know if stress, there's so many theories out there, during your pregnancy could actually affect basically the information transmission mechanism levels, and of course affect the chemicals we have for this information to circulate in our brains, like dopamine or noradrenaline. So there's some dysfunction in this level, like the information transmission mechanism levels in our brains. So honestly, I would love parents right now to be aware of this condition and not to look at their children differently, because a lot of people out there who are successful in life actually have ADHD. There's many doctors that have ADHD. There's engineers, accountants, people. They need awareness, insight, and also medication. Of course, ADHD is actually treated, not necessarily treating it to cure it. We do give medication to control it because, like I said, it can be very tiring because people with ADHD, they are very energetic. They have so much energy. They talk a lot, and hyperactivity. Kids with it, when they come to our clinics, they could easily climb the chairs. The next thing, they go touch the medical equipment. You can't just regulate them, right? And it's not because they want to do so, it's just how they are wired in their brain. So I know that parents, they tend to be impatient with these type of kids. Just remember this: you have a unique, beautiful child whom she did not apply for this, and yourself, you did not apply, more especially if it came about prematurity. Of course, people when they are pregnant, they need to be aware of these toxins that could actually predispose themselves to this condition. So how do we treat? Like I said, it could affect your sleep. So these children, they do need to sleep. And also the other non-medical way of helping your children is to avoid too much TV. Anything that is stimulatory, like the video games, we let our kids play these things because they can also get the kids excited, which is not necessarily adequate for child with ADHD. And of course, there's medications. I know this part, a lot of times parents kind of become a little pushy. They're not sure if they really want to put their children on medication. Remember this, I said kids with ADHD, it can be difficult to deal with them if they do not get the help they need, because like I said, it can affect relationships. If you have the friends that are impatient, who do not understand you, even at work as an adult, because like I said, it could affect adults. You find yourself, you're moving from one job to the other. You find yourself, you're hopping around relationships because you believe that people maybe do not like you. And yet, if you had to be medicated, given the medications you need, the right dose you need, you would have a normal, enjoyable life and enjoy life like other people. So here's the thing. I would love to talk to parents here who are still thinking maybe a psychologist in their schools kind of indicated that these kids need to be medicated. I want to actually reassure you this. With this, ADHD does not mean your child is disabled. That's number one. It does not mean your child will never have a future. Like I said, I know of successful people in the world who have ADHD, who are medicated and who are doing really well. You just need to have the right medication and the right dose. Sometimes things like if it's a school break, we always, talk with the parents if they want to take a medication break. Holiday, we call it medication or drug holiday. You could actually stop your child's medication and give your child a break. And these medications, they come in different doses. And usually it's an extended release medication. It helps the first part of the day. Your child is able to concentrate, is able to have good relationships, is able to have good feelings about himself or herself. It helps your self-esteem. Because imagine if you are an agitated person, you are an irritating person, you are hyper, you are not necessarily able to wait your turn, you are fidgety, you are you are inattentive, you are unable to finish tasks. That's very hard on your emotions, you yourself, when you are struggling with ADHD. So imagine if your child is going through that and is growing. So parents, I am here to beg you or to actually reassure you that these children, they do really well when they have the right medication. And actually some kids, they outgrow it and they don't necessarily need medication at some point, or they do need to continue on meds. I'm gonna drop really cool literature down here and check it out, and you can discuss this with your family doctor or you can discuss it with your psychologist. But all I can say is remember this: children with ADHD aren't abnormal. They are not disabled. They have the same needs, the same love, and the same intelligence like their counterparts.